No longer a discussion going on. The discussion between the government and junior doctors' leaders is finished. The contract is being imposed. What is this strike for? So
the discussions haven't finished themselves. Discussions still need to happen.
The negotiations are over.
The Department of Health have walked away. The NHS employers, the government have stopped talking to the BMA. And yes, they've said they're going to force a contract on 53,000 junior doctors in the UK.
So what are the strikes for?
So the strikes are really our only option. We want to talk some more. 10% of the contract which isn't negotiated, we don't agree with. We still don't believe it is fair. We still don't think it is.
It is confusing here, and we'll come to patients in a minute, but, you know, the Prime Minister, David Cameron's official spokesman, saying we have been clear throughout discussions with junior doctors. We want to work with them to look at how we bring about a 7-day NHS, which we think is in the interest of patients. It's regrettable if they are going to strike again. They say, I'm sure discussions with them will continue.
Absolutely. See, on one hand, they're saying that they want to talk, and we, of course, want to talk. And the whole slogan of 7-day NHS, I've said this before and I'll say it again, we have a 7-day NHS. We provide emergency cover. Any patient out there who is unwell, whether it is a Sunday or a Monday or a night or a day, you will be seen by a doctor 24 hours a day. We have a 5-day elective service because that's all the funding we have to develop a 7-day elective service, 7-day routine service. We need more doctors. We need more nurses. We need more allied health professionals, everyone who makes up the NHS. It takes 4 to 5 years.
Right now, where junior doctors are going to go on a series of strikes, and the government is saying those negotiations, that part of the discussion is over. The contract will be imposed. So at the end of these strikes, if nothing has changed, do you escalate further? Will the next round of strikes be longer in order to make more of a point? Because people will be concerned.
It's very difficult to say, and obviously our hope and our aim is that we don't have to go this far, that the government will turn around and go, actually, OK, we can go back to the table and talk.
What I'm asking is if that doesn't happen, and there's no indication that will.
No, I think we'd have to consider really carefully. The whole way we've been saying that we need a fair and safe contract. We need a safe contract for the future of the NHS, for patients, for doctors. And if we compromise now, what does that say about us?
As an individual, because that was the point you made before, as an individual doctor, are you prepared to escalate it further, to go on strike for maybe longer periods of time?
As an individual doctor, day in, day out, I make decisions for the safety of my patients. I don't think I'll ever be able to compromise on the safety of my patients. And if I'm forced to work on a contract where I think I'm not safe, I'm pretty sure I speak for the many thousands of junior doctors out there, I don't think I'll ever be able to compromise on that. So if you're asking me whether I will work a contract which I do not feel is safe, then no, I won't.
Dr. Patel, thank you for your time this morning.
You're welcome.
Thank you. It's 17 minutes past 7. We've been out and about this morning on breakfast. It's looking lovely, Carol, but it is cold, isn't it? Morning.